And now it's time for Through the Eyes of Dr. Mittleman, brought to you by Mittleman Eye with 2 locations, West Palm Beach and Jupiter. And now here are your hosts, Jill Schweitzer and Dr. David Mittleman.
All right, my joy. We're here with Dr. Mittleman from Mittleman Eye. Through the Eyes, always such exciting trips and adventures, and I'm living vicariously through you. But Dr. Mittleman, well, firstly, good morning.
Good morning, Jill.
We're going to go in a little different direction on these travels. We're going to go right to Mittleman Eye. You have 2 offices, and let's talk about today, if we may, just some of the things that you hear from patients, things that people believe that perhaps are not necessarily true, things that you have to sort of walk them through. Where do you want to start?
So we can talk about office myths, legends, misconceptions. There are all different kinds of things that patients don't really understand because they don't know the back workings of how an office works, how insurance works, how testing works. And so patients have a lot of questions. There are a lot of misperceptions, and I think that it's worthwhile, not just for Mittleman Eye, but for any eye office and any doctor's office to understand the way things work. And so one of the myths we hear is that people complain that there are too many tests. Why are there so many tests? Well, one of the reasons is we have modern technology. And so when you think about the tests that we do, there are so many. There's testing to find out what is the closest prescription we can get to you. Now, what a computer says your prescription is isn't always what your brain wants, but it's a great starting point. In the old days, we had to use a light waved up and down in front of your face and try to focus that light. It took forever. It was inaccurate, and the computers are extraordinarily accurate. There are tests for glaucoma. How thick is your cornea? What's your peripheral vision like? What's your optic nerve look like? There are tests for macular degeneration and diabetic retinopathy, which tell us how thick your retina is, whether there's swelling in your retina. There are tests for the cells on the back surface of your cornea, cells that I can't see. All of these tests add to our understanding of an eye condition. Not every patient needs every test every time, but these tests give us information that we didn't have 20 years ago or 30 years ago when I started practice. It's important that the doctor keeps up with this. Just like there are tests now for cardiac disease, there are calcium score tests. And so when people think about going to the cardiologist or the gastroenterologist, they don't generally say, why am I getting all these tests? They know there's something wrong with them. You might not know there's something wrong with your eyes until it's too late, and that's the hallmark of many eye diseases. You want to intervene early, and these tests will give us the potential capability of intervening, treating, and preventing issues. And so we do these tests because, honestly, the tests are better than I am. They see more than I do. It's as if you were looking through a regular microscope from Radio Shack, a Tandy microscope, or an electron microscope.
Well, it's funny you say that because one of our listeners went to you for cataract surgery, and she said it was the most comprehensive eye exam she had ever gotten, and she was thrilled because, if you're about to get surgery, you want to make sure all the knowledge possible is available to the doctor. So it's interesting the way different people interpret the things that are happening at the doctor's office.
Exactly. And so one of the other myths that people say is, isn't all cataract surgery the same? And it's not. So when I learned 35 years ago, I did what's called an intracap. And you take the entire cataract out in one piece with an ice probe, and you yank it out. It's horrifying. And you use about 17 stitches, and about 50% of the people get retinal detachments. We don't do it that way anymore, but that was standard of care way back when. The next step was an extra cap, where you leave the membrane behind. That's what you take out in an intracap. But again, very large incision. You take the cataract out in one piece. Lots of stitches. And then we got to phacoemulsification, phaco lens emulsification to break up. The incision went to 7 millimeters, then 6 millimeters, then 4 millimeters, and now it's at 2.4 millimeters. It's tiny. The next evolution is to use a laser to make the incision more precisely to break up the cataract. But when you go through these things, there are a lot of considerations. How well do you dilate? What does your cornea look like? What does your retina look like? And so when we do cataract testing before surgery, we have a myriad of tests. I run them twice. So it's not just one test once. It's multiple tests, 4 or 5 tests, and then done on a second day. My rule is measure twice, cut once. I don't like mistakes. And so sometimes people say, why am I being measured? I'm just going to have surgery. I'm having an implant put in. But you want the right power implant. You want to put it in the right place. You don't want complications of swelling or inflammation that don't go away. So it's not all the same, and it goes back to this testing. As Benjamin Franklin said, the prepared mind does well, or something like that. I'm sorry, I'm misquoting Ben. Sorry about that. But you want to be prepared. You want to know what you're getting into, because that will stave off potential complications and give you the result that the patient wants.
Absolutely. I mean, look, again, for me, this would give me confidence, but I'm sure everybody's different. How long does it take, and do people complain about that? Like, is that a?
So in most offices, people wait. This is modern medicine, and there's more waiting for an eye exam than there is for any other kind of exam, because when you examine the eye, you want to dilate the eye. You use dilating drops. Most people who have had an eye exam are familiar with dilating drops. They take about half an hour to work. So at the very minimum, you're seeing the technician at the beginning for 15 to 20 minutes, and then you're sitting to dilate for half an hour. And if you have no other testing, then you go to the doctor. So you're over an hour just because you have to sit there and be dilated. And then, of course, one of the most common complaints I have is, why are you dilating me? I don't understand. I stay dilated for 6 hours, for a day, for 2 days. It's horrible. But you can't see the back of the eye completely without the dilation. There's no easy way to reverse it. There's no easy way to make it happen quickly. And so you're in the office. You're also in the office for all of these various tests. And people want to know why I don't do the test. Why doesn't the doctor do the test? I have very good technicians. They're certified. We have a certification process with levels of certification, starting from intro levels to technicians that can do many of the things that I can't do. But you don't want your doctor who's spent 12 years studying to do a test where he's lining up your head and pushing the button. He would only see 5 patients a day, and the wait, instead of a month or 2 to get in with your doctor, would be 4 years.
Well, I'm sure that, insurance is a big sort of topic these days, and what will it cover, and what, how does that work? I personally need to see you. I haven't been to the eye doctor in a couple of years, and I know how important it is to go regularly, because especially at my more mature age, these are things that can change from year to year.
So it is important to have regular eye exams, like it's important to have a regular physical. So we recommend, along with the guidelines of the American Academy of Ophthalmology, that under 50, you get an eye exam every 2 years, and over 50, you get an eye exam once a year. Now, this can vary if you have particular body conditions, what's known as a systemic condition. You may want to come in more frequently, but those are the guidelines. And so when we do these testings, we try to find out things that we might not otherwise find out. But there are different kinds of insurance. There's medical insurance and there's vision insurance. Vision insurance is for eyeglasses. Medical insurance is for everything else. Do you have glaucoma? Do you have macular degeneration? The interesting thing about this is that if you're using your vision insurance, that will get you a prescription for glasses, but you can't be treated for a medical condition like glaucoma. And if you have a medical insurance issue, you're coming in, my eyes are red or itchy, you can't get your eyeglass prescription. Medical and vision insurance cannot be used on the same day, and patients are often upset by this. Why can't I get my prescription? You did it. When we do it under medical, we do it as a courtesy, also so that we can see what the prescription is. Can the vision actually be made better? Is there an issue where the vision can't be made better and we have to figure out what it is? But under insurance rules, you can't get a prescription under medical insurance, and under vision insurance, you can't have treatment.
So leads me to my next question. So you and I spoke a few weeks ago because I wear these readers that I get on Amazon, because I've tried the readers that my optometrist, prescribed for me, and they make me dizzy. That I did the whole thing, and I talked about the surgery that could help me get out of readers, and we went through this just because I was just curious. And you told me there are several options. There's not just one. There are different ways to go about this. So what are the different options, from the least expensive pair of glasses to something that's a more expensive procedure?
When you come into the office, what we try to do is try to figure out what your needs are, what you're using your eyes for, what you're doing all day long. So somebody who sits in bed and reads a book all day long is different than the golfer who needs distance and intermediate vision, than the welder who only needs intermediate vision, than the truck driver who drives at night who needs good night vision. And so when you visit our optical shop, one of the things we get from patients is that they're telling me about all these expensive options. There's a reason for that. We want to fit the right technology to the right patient. And just because a patient says, I may want the simplest thing, doesn't mean that that's going to be what's best for them. So you can wear reading glasses for reading. You can wear bifocals. That will help with the intermediate vision. There are some people who sit at a computer all day long, and they use computer glasses, where the top part of the glasses is not for far away, it's for the computer. But if you just wear computer glasses, you can't see up close. So these computer glasses made by Essilor are really wondrous things. I have a pair at my desk. They let you see the computer. They let you see up close as well. And then if you really need to see across the room, get a visual, you bend your neck down and you look to the very tippy top, and you get about 5 or 6 chins doing this, and you can see across the room. There are various coatings. Some people believe in blue blockers for the computer. I don't necessarily believe in that in 2026. My opinion may change in 2027. But there are different kinds of bifocals as well. Bifocals with a line, bifocals without a line, bifocals in a D shape, bifocals that go across the whole lens. And so when the optician talks to you at Mittleman Eye or at any other office, it's important to listen, even if you want the least expensive, because that may not be what's going to work best for you. And if it winds up that is going to be what works best, then more power to you. Beyond that, you can wear contact lenses. We have multifocal contact lenses. You can wear a contact lens where one eye is near and one eye is distant. I'm not a big fan of that. Only about 50% of people can handle that. I tried it. I tried it while skiing. That was probably not the smartest place to try it. I almost couldn't find my way back to the lodge. Or you can have surgery, and you can have lens replacement surgery if you're anywhere of 45 or 50 and up, and you put a multifocal lens in the eye that actually will let you see distance, intermediate, and near. Similarly, I have patients who say, I don't want to wear glasses for my food. I don't want to wear it for the dashboard. I don't want to wear it for driving. But I don't care if I wear reading glasses. And we have implants for that. And each implant has a plus and a minus, or many pluses and many minuses. And the idea, again, is to have the conversation, which makes the visit long because you'll be speaking with many different counselors and technicians to try to figure out what is going to work for you. We try to fit the technology to the patient, and that takes time.
Well, we are getting to know each other well now. And one of the things that impressed me from the very beginning is I feel like you have this philosophy in your office and a culture that you have created there that it just feels like the type of doctor I want to go to. Can you explain to our listeners what your philosophy is?
So we have a mission statement, and then we have a philosophy, and these are posted all over the walls for the staff to see, not necessarily for the patient to see. It's something that we have to keep in mind at all times, and we actually do quizzes. We make sure that everybody is well-versed in these philosophy tenets. I've heard people come to us, employees, when we hire them, and they say, "Oh, my last job said you were going to the cult of Mittleman." And that puts a big smile on my face, because we do not necessarily have a cult, but we have a culture. And it's something that I think is important. Your doctor needs to know what he wants to do in life, what he wants to do with his patients. So our philosophy, in a nutshell, is that we want to provide a lifetime of vision care in a setting of excellence. And so when you parse that out, a lifetime, we don't just want to see you when you need surgery. We want to see you for your entire life, and we want it in a setting of excellence. We are constantly trying to improve, constantly getting new equipment, constantly training and retraining. I have to retrain on all new techniques, on new medications that are coming out at an ever-increasing pace. But that's what we want to do in the office. But there are some things that the patients want, and we acknowledge that. We acknowledge that patients have certain outlooks, certain desires, certain needs, and we've identified 5. And these 5 are really our guiding principles. So we want patients to know that they have access to their doctor. And so at Mittleman Eye, we have 8 doctors, soon to become 10 doctors. We have 2 more doctors coming. And so you can always get in no matter what the emergency. Now, it may not be the doctor that you're used to seeing, but you can always get in. We have people calling all the time, and we bring them in immediately if they need to come in. Because the worst thing is to have a problem with your eyes or any other part of your body. Call the doctor and say, "Our next appointment is 7 weeks." Now, there are those people who will only see me, and I will tell you that all of my other doctors are well-trained, and if you get in to see one of my other doctors and you want my opinion, I will pop in, as will the other doctors if you're seeing one of the other doctors regularly. Respect their time. This is something that is the most difficult on the list. We try to get patients in and out, but there are the constraints of testing, of counseling, and of working in other emergencies. So if I have an emergency coming in with a retinal detachment, that takes priority over the average patient that just wants a pair of glasses, even if that patient was scheduled. We do our best. Many days we run ahead of schedule. Some days we run behind schedule. It does seem in the office that it's very busy. We are about to take over the 6th floor in our building, so we'll have 5 floors to try to spread people out. So it doesn't seem as if we're not respecting your time. Even when we run on time, if it seems overly busy, patients can get a misperception.
You know, I have to stop you there. That is a fascinating point and perception on your part. I've noticed that when I go into a doctor's office and it isn't just jam-packed full of people sitting in the waiting room, that gives me anxiety right out of the box. I start getting anxious about all the people and like, oh, this is going to take, even if it doesn't end up, I still feel the anxiety. Conversely, when I go to an office, which I did last week for oral surgery, I was the only one in the waiting room. I was taken back almost immediately, and it just set the tone for my sort of blood pressure. You know what I mean?
I do.
I love that you acknowledge that and understand that psychology of a patient.
So it is important, but everyone needs to remember the economics. And rent is expensive, and office furniture is expensive, and doctors are cut 12% a year. So if you think about what inflation is, how much gasoline costs, how much food costs, how much insurance costs, how much employees are paid, because we like to pay our employees well, we're getting cut 12% a year, and it's harder and harder to make ends meet. So when we take over the 6th floor, it's with eyes wide open, knowing we have to be able to pay for that 6th floor, anticipating an additional 12% cut every year. But it is important for patients to feel comfortable. One of the things I tell patients, though, is that if you go to a doctor's office where there are a lot of patients, there is a reason why there are a lot of patients. That doctor's probably pretty good. He's pretty well known. Everybody wants to see him because he has good outcomes. And if you go to an office with no patients in it, other than the first patient or the last patient of the day, you think to yourself, why is no one here? Does no one want to see this doctor? So there's always a yin and a yang. You always have to look at problem from both sides, look at the clouds from both sides now. Mm-hmm. It's important to understand that what you're perceiving isn't always reality, and there's potentially another reason. One of the things we want to do at Mittleman Eye is give people value for their money. That's our third tenet, especially in today's economy. You don't want to spend money on things that are unnecessary, and I will often tell patients, happy to sell you a pair of glasses for $500, and you're going to come back and say, Dr. Mittleman, why did you tell me to get this pair of glasses? I can't tell the difference. We are very careful to try not to have people get something if it's not going to help them. And when we do recommend something, it's fully aware that it's patients' money. And I will often say during surgery when we're talking about laser or advanced technology lenses, I don't want to take food off your table. It's your money, it's your eyes. You need to decide what's most valuable and what's most important in your life. So value for the money is a key tenet. We want happy patients. One of the things that I often see in the office, and this is our fourth tenet, is that patients will come in, new patients, they've been to several other doctors, and they have no idea what's going on in their eyes. Similarly, I've heard friends say, I've come back from the cardiologist and I have no idea what he said. Plain language. Patients want things explained in plain language. And so we try to put things in a language that people will understand, and everybody's at a different level, from somebody who doesn't really understand English, and then we always try to get a translator, or somebody with an advanced degree, but that advanced degree might be in English literature and not in optics. So we try to explain things as long as it takes to make somebody understand. We have handouts, we have videos, and if it requires multiple visits or having a patient come back with a friend or a family member, that's very important. Plain language so that they know what we're talking about.
And that goes to your point, too, of really, you never know how long it's actually going to take with a patient, because we're all individuals who may understand something more clearly than another. And like you said, the myriad of tests that are necessary, the different things. So that sort of, I do keep that in mind when I'm in the waiting room, because you just don't know. Things pop up, things, happen that.
So one of the things I like about technology and these tests that we do is they're visual. And you can talk and talk and talk to a patient, and they may not get it. And when you put their test up on the screen and you explain the test and show them what's happening, the light bulb goes off. It's an aha moment. And so the testing not only helps me and my other doctors to figure out what's going on and what to do, but it also is a learning tool so that the patients can enter into a partnership with the doctor so that they can become part of their own care. The last part, the last tenet, is patients want to feel like somebody cares about them. And we do our very best for that. We try to make the environment comfortable. We try to go slowly. Patients will often say to me, I know you're very busy. And I say, no, we're going to take our time and explain to you until you understand it. Now, that sometimes doesn't happen. And I say, you know what, I want you back next week with your husband or wife or your son or daughter, because I can say this 10 times and you're not getting it. I need another set of ears. But that also shows charity, because I don't just say, okay, we're done, go away, come back in 6 months. I will take the time to see them again. I will take the time to call a family member. I can't tell you how many times family members are on the phone because they can't come in. That takes extra time. We have this cool device on our Apple iPad, which will bring up a translator, and sometimes somebody who does sign language. We have many different people of different ethnicities and backgrounds in the office who will speak different languages, but we can't speak every language in the office, and so we pay for a service so that we can translate, so the patients will know what's going on. They know we care about them. We're not reimbursed for this. It's just part of good medical care.
It just brings me to you get what you pay for. And it really is why you're the 8-time winner of the Community Choice Awards in Palm Beach County. It's this sort of, culture and philosophy that you have at Mittleman Eye. So when somebody says, well, why do I have to pay a copay here? Why just, this is expensive, whatever. When you explain what your patients are getting, you sort of say, okay, this is, I want, your eyesight is everything. I mean, it's not everything, but it's super important for your quality of life and the way that you, your longevity.
So I often will say to patients, my job is to keep you seeing until you're 100. And if you live past 100, I'm not going to desert you. I will be there. So it's very important to know what the patient wants, what the patient needs, and how we go about getting that in a way that the patient is happy and satisfied.
Mittleman Eye, I've heard about you forever. You have such a great reputation. And like I said, our listeners have reported back over and over of the incredible quality experience they've had in your office, post-op, surgery and the follow-up, and just the results have been fantastic. So I just am so glad, Dr. Mittleman, that you're here in Palm Beach County. We're very lucky to have you.
Well, thank you. And part of it is I do still like what I do. I love what I do. And I try to have employees that love what they do because I want that to come through, that we do care. We do want to do what we do. We're there for a reason. That work is not necessarily always a 4-letter word. And one of the things I get from patients is that people will tell me how happy the staff is and how they want to help. And when I hear that, I'm thrilled.
Well, Dr. Mittleman, another great visit with you on Through the Eyes of Dr. Mittleman. And I cannot wait to see what we're going to be covering next week, 8 o'clock, Saturdays, right here on Legends 100.3.
Thanks for listening. And remember, when you go to the eye doctor, cut the doctor some slack. They're really working for you.
Thank you for listening to Through the Eyes of Dr. Mittleman here on Legends Radio. You can tune in every Saturday morning at 8 a.m. for another edition, brought to you by Mittleman Eye, 561-500-2020 or mittlemaneye.com.